In 1972, my daughter Stephanie was diagnosed with a brain tumor. She's about 4.5. Her birthday's in August. It was 5 that August. We were told that they could do radiation, but it would be 6 months to 2 years. The tumor would come back and there'd be nothing else they could do. I talked to Dr. Amundi. I said, is there anybody raising funds? Is there anybody doing anything? Look, he said, not really. I thought, okay, we're going to start an organization to raise research funds. I was going to find some cure that was going to save my child.
In 1988, my brother Joel was diagnosed with a brain tumor when he was 26 years old. The purpose of the JAG Fund, when we first started doing it, was to raise money for brain tumor research and raise awareness. And there was always a third, which was to remember Joel. But as the years progressed, we added a fourth element to it, which was providing assistance and direction for people who are diagnosed with brain tumors. That's their darkest time. And to be able to make a phone call to talk to somebody who understands their pain, understands their diagnosis, and can provide them with some direction, some comfort, and comfort oftentimes comes in the form of information.
These cancers and these situations don't come with a roadmap, right? So having somebody help you navigate it, I think, is very, very important, especially with something that is affecting a brain that affects so many other parts of a person, from their physicality to their functioning and to their cognitive abilities.
They provide validation, but they also provide a sense of community for people going through this, whether you're a caregiver, clinician, or someone who's a patient.
The ABTA is such a fantastic organization, and we've, at the JAG Fund, have been fortunate to visit their offices, attend their doctor-patient conference, where we learn so much in terms of how they take the dollars and disperse them for individual research grants, the vital researchers on the front line trying to find a cure for the brain tumors.
What has been amazing with the American Brain Tumor Association is their ability to support young investigators with research funding, to allow them to start gaining experience, getting data, preliminary data, that could launch themselves to be candidates for successful funding at the NIH level.
ABTA has been such a strong supporter of my work since I've been a medical student. I received my first grant through ABTA when I was a medical student, and then received a fellowship award when I was a fellow and junior faculty member. And that first grant was what helped me initiate a lot of the research that I'm doing.
I think one of the most important things to know about people that have brain tumors is that we're very resilient. You know, back in the days, if you thought someone had brain cancer or brain tumor, it was considered, people felt bad for you. And the truth is, we've made a lot of progress in the way we treat brain tumors, the way we diagnose people.
In the last 30 years, our understanding of the genetics of brain tumors has increased substantially. And for some types of brain tumors, not all, we're able to identify targetable mutations, meaning clinically actionable mutations or mutations for which there are targeted therapies, and we can treat patients with specific precision medicine approaches.
Tumor Treating Fields is a cancer therapy that uses electric fields to disrupt cancer cells from dividing. This disruption causes affected cancer cells to die.
So a lot of the ABTA funding has led us to make discoveries in the lab that have actually led to clinical trials.
One of the other impressive things I remember going to one of the patient meetings is the fact that they bring the scientists to those meetings, and to have the scientists connect with the patients and to actually see what their role is. That it's not just an abstract, it's a patient with a brain tumor and a family that's being affected.
We got a chance to quiz the actual doctors doing the research at that time. The doctor looked back at me and said, "Boy, you are a tough interviewer." I said, "Sir, I have to stand in front of 300 people and confidently reassure them that the money that they are donating is going into the right hands." And I can say, yes, the money is going into the right hands of the right people, and they're doing simply amazing things with it.
The big thing we need to do is figure out how the money is being distributed, how the money is being used, and really hold accountable the institutions where the money's going. Because medical research is so expensive to really move the needle, we need organizations like the ABTA who are really a clearinghouse for who's doing the best work.
Maybe the thing that I'm most proud of is that we have touched the lives of a lot of people in ways that I don't think I realized. I'm very proud of where we've come and the research that we've funded and the information that we have disseminated over the years.
Without you, we won't be able to succeed. We won't be able to find better treatments. We won't be able to find cures. Don't give up and don't quit and keep supporting, because it ultimately will get us to the ultimate goal of eliminating brain tumors.